for health insurance under the Affordable Care Act is quickly approaching. You need to be signed up by December 15th in order to get coverage for the new year on January 1st, 2016. And we have with us today independent insurance agent Mindy McIntosh from McIntosh & Associates. She's here to tell us about what you should consider before choosing a plan. Thanks for being with us.
Thanks for having me.
Okay, so what if we're happy with the plan that we have? Do you have to re-enroll?
You do not. So that's a big question. A lot of people get messages and calls from the marketplace themselves. And if you're happy with your plan and your plan's actually renewing, it will automatically renew.
Okay.
You don't need to do a thing. We're getting so many calls, though, because there's plan tweaks with a lot of the plans.
Okay, so they just want to let you know about what those changes are?
Yeah, so the clients get a rate increase and plan changes. And we're getting a lot of calls. We're helping people re-enroll and change plans because they're seeing anywhere between 5 to 18% rate increases.
And why is that?
Well, with the federal Obamacare administration, they're seeing that on average, 86% of people, though, can move and change into a different plan to have some savings. So we're just seeing overall cost and exposure to the plans are increasing kind of across the board.
Okay, and so how can we make sure that we're choosing the best plan? It's kind of an overwhelming process, I know, for a lot of people.
Yeah, so what we do is we kind of put together a 4-step process. So we say, first, let's start off, easiest way to examine your current plan you have now. We take a look at what do they have for coverage needs, what is their out-of-pocket expenses, and then has that plan truly worked well for their benefit and budget needs with what they've had over the course of the year. We also like to say, update your information. From year to year, people are having to estimate what their income's going to be.
Right,
so they call our office and say, hey, Mindy, I need you to update. Our income's going to be this amount next year. We've moved. We had a baby. We've had a job change. So that's very important. Utilize your agent for that. The marketplace can be a very confusing spot to go. So if you utilize our office, we can make all those updates and changes on your behalf.
And then another good idea is to know that there are a lot of options. You don't have to pick right off the bat, right?
Correct. There's so many options that if you deal with an independent office, which is what we do, you don't pay any extra cost to use an agent versus to try to go out to the marketplace and sort through all the options on your own. So you can kind of look at plans and really decide, is your doctor in network? Are your prescriptions covered? What are your needs not only monthly-wise for your premium, but, how is it going to affect you when you actually make some claims?
Right, because a lot of people know already that they're going to have certain expenses, whether it's a prescription or a checkup that they want to be getting, so make sure those are covered under the plan you choose.
Right, and so they can make sure they're covered. We kind of put a tool on our website at Wealth Michigan as well to kind of look at the true out-of-pocket costs for clients, so that way we're really deciding what's best for their needs for that next year, and might be switching from company to company from year to year on their needs.
All right, thank you, Mindy. And one more time, what's the deadline?
Deadline is December 15th if you want coverage for January 1st.
But again, if you are happy with your program, do not have to re-enroll.
You don't have to re-enroll. And they actually have until January 31st. That's the last day they can decide. But most people want a new plan to start at the first of the year.
All right, thank you so much. Mindy McIntosh from McIntosh & Associates. Thanks for being with us.
Thank you.